So I don't think we know the exact answer for that. But I do know that through a project that we have in which we're trying to identify girls, particularly adolescent girls, that present with acute heavy menstrual bleeding, so bleeding that leads to anemia or severe enough that would qualify as heavy menstrual bleeding. We've taken the approach to utilize combined oral contraceptives or norethindrone to reduce the bleeding, so our hormonal therapy approach for those patients. Ultimately, about 6 to 7% of them go on to have a bleeding disorder. What we found is that those strategies actually still seem to work pretty well for those patients. And we have quite a number of patients, particularly those even with very severe disorders. So we have patients with Glanzmann's thrombasthenia, and we have a couple of hemophilia carriers with levels in the single digits that have responded very well to hormonal therapies. And so we tend to utilize those as our upfront approach. And obviously, if there are contraindications, we have to move up to our second tier, which typically includes things like Depo-Provera or intrauterine device. And so those are sort of the strategies that we've utilized as our upfront approaches. And some patients that are not willing to do hormonal therapy or have some other objection to it, we've considered antifibrinolytics. But my general sort of feeling about that is it's not a good long-term strategy, and we have very few patients that will utilize that for more than 6 to 12 months. And then certainly there are some patients, particularly those with von Willebrand disease, those that are hemophilia carriers, or those that have levels in the hemophilia severity range, in which doses of factor replacement during the initial period in the first few days, there may be a role for that. We don't have a lot of good data on that, but there are some ongoing trials, one at our center and one that Dr. Ragney is running from Pittsburgh, trying to look to see is there any role for factor replacement. But I think it's important to understand that hormonal therapies often are successful in this population and should be considered as you would in patients that don't have a bleeding disorder.